My name is Hannah Scott. I'm a second-year Master's in Public Health student with a focus on policy at the University of Arizona College of Public Health. I completed my internship at the Colibri Center for Human Rights during the summer of 2020. The title of my project is Fostering Resiliency Through Advocacy and Community at the Colibri Center for Human Rights. Today, I will provide you with this information on my project. The Colibri Center for Human Rights is located in Tucson, Arizona. The mission is to promote healing and change by working with families of disappeared migrants to identify and honor those who have lost their lives on the US-Mexico border. There are three main programs at the center: the Missing Migrant and DNA Project, the Family Network, and Historias y Recuerdos. Starting in the 1990s, the federal government implemented policies such as prevention through deterrence, which sought to control the southwest border by heightening the risks associated with unauthorized entry. To do so, the agency concentrated enforcement and infrastructure to reroute migration away from urban ports of entry and into the most hostile and desolate areas of the desert. The increased danger was intended to deter other people from considering the journey with the overall goal of preventing migration. Over time, the conditions continue to worsen in countries in Central and South America. Migrants continue fleeing and risking their lives on a perilous journey. Colibri has investigated 3,475 disappeared persons. Since 1998, there have been over 7,805 deaths along the US-Mexico border. Colibri works with forensic scientists, medical examiners, consulates, other NGOs, and the friends and families of the disappeared. For my project, I wrote a policy brief about the immigration policy Migrant Protection Protocol, also known as the Remain in Mexico policy. I completed a systematic review of the existing literature and research on the policy. This policy allows U.S. border officers to return non-Mexican asylum seekers and other border crossers to Mexico as they wait for their time in immigration court. This is a change from the previous policy that allowed asylum seekers to wait for their time in court within the U.S. This policy forces asylum seekers and other border crossers to remain in various areas of Mexico, some of which are very dangerous, with no support. They are vulnerable to cartels, kidnapping, rape, and assault, the same situations they fled. Initially, asylum seekers were told they would have to wait for 45 days for their cases to be heard. Quickly, this timeline changed to months or years for some. Ultimately, I recommend, along with border advocates, that this policy should be immediately discontinued by Congress. The other area of my project was on the Historias y Recuerdos project. Colibri collects oral histories from people whose loved ones have disappeared while migrating to the United States. The story I worked on was the story of Mateo Dolores Salazar. He was last spoken to around 2 years ago. Like many families in their position, the Salazars talk about how after his disappearance, they reached out to numerous state agencies and other organizations that were unable to help them. The family members each talk about what their father means to them, and they describe the ambiguous loss they feel from his disappearance. I wrote a script for the recording and recorded my audio. The final audio will be used for educational purposes throughout the state of Arizona. The Trump administration and previous administrations have passed policies that have criminalized immigration. The effect this has on migrants, immigrants, and border communities is significant. Many of the issues I looked at, I learned about during the Border Health Service Learning course. Lives will continue to be lost and negatively affected if border policy is not improved. I truly enjoyed my experience working with the Colibri Center. I'm so grateful for their flexibility and willingness to adapt during the pandemic. I further learned about the kindness and generosity of people experiencing great loss, of people who, despite experiencing great loss, continue to remain hopeful and caring. I'd like to say thank you to the Colibri Center, especially to Parlatores. I'd like to say thank you to the Western Region Public Health Training Center and to my advisor, Dr. Stephanie Russo-Carroll.